Casey, thank you very, very much. Obviously, the case of this gentleman in this Dallas hospital is going to raise hackles again as to whether we should start screening those coming from this region of the world. The CDC director says it is possible for Ebola to become airborne, but not very, very likely. Still stands by the administration's official position of not screening off this area of the world, but more intense screenings. To emergency medical physician Dr. Ernest Patti, who really doesn't like those odds. Why not, doctor?
Well, you know, we have to just remember, Neil, we can't freak out. We have to remain vigilant. And
what does that mean, doctor?
Well, what does that mean? I'll give you an example. Yesterday I was on duty in the emergency department, and we had some folks who came in who had relatives who visited from West Africa. And they came to the hospital because they were concerned about possibly being exposed. Fortunately, these relatives arrived way after the 21-day limit. Everybody was asymptomatic, and everybody was counseled and made to feel better and were able to go home. But one of the key questions we asked them at presentation to the emergency department is, have you recently traveled from West Africa? We named the countries. We asked them if they've had any signs of or symptoms of illness, and we also screened them for fevers.
All right, doctor, I don't mean to jump on you, and I'm not going to interrupt you yet. I mean, we're getting the details of the particulars, who's going to speak at this CDC briefing in Atlanta. We'll be hearing from the Deputy Secretary of Homeland Security as well. But, doctor, what do you want to hear from these guys before they come up? Wait a minute. Here's the CDC director first.
From our Fox Business Network studios in New York City, here is Maria Bartiromo.
Jeff, thanks so much. Jeff Flock at Chicago O'Hare. I want to bring in Dr. Ernest Patti. He is a senior attending physician at St. Barnabas Hospital. Good to see you, doctor. Thank you for joining us.
Thanks for having me.
Well, we just saw what's going on in Chicago and all of the other airports. Is this screening enough, do you think?
Well, the screening is definitely a great first step. We have to be vigilant in trying to pick up those patients that are at risk and isolating them and getting them the proper treatment. You know, remember, we're talking about human lives here, whether they're in Africa or they're here. Everyone is, you know, important to us, and we want to treat and prevent the disease from spreading as best as possible.
How do you do that?
By remaining vigilant, by the proper screenings that they're doing, where they're asking folks if they've had any symptoms, they're checking for temperatures, and also by educating the public. People need to know that this virus is transmitted like the common cold, like influenza, any kind of virus.
Right.
You know, it's in your secretions when you're sick. Only when you're sick. And if you are sick and you're around other folks and you're coughing or sneezing, you know, you can aerosolize it and spread it around. You know, I brought my little spray bottle to show you. You know, we can.
Yeah, you cough and that's.
You cough.
It's all over the place.
Cough and sneeze, and it can get on doorknobs and you know, in closed quarters. So you need to be careful. But the key is getting these people isolated early. We had a few cases at my hospital the other night where we had to screen folks. Fortunately, they were past the window. They weren't symptomatic, and we were able to reassure them.
And so wash hands. I mean, all the things that you really...
All the things you do for the flu, yes. Cover your cough, you know, wash your hands frequently throughout the day, especially before and after meals when you've been in public places. You know, after you use the restroom, open and close the door with the paper towel that you're using, rather than your bare hands, so your hands remain clean. Do
it again, just to really explain your point. That was a good analysis.
Well, the virus is only in your secretions when you're infected.
Right.
But if you sneeze or cough and you're infected and in a closed space, you're going to mist your saliva, mist your nasal secretions.
And it goes all over the place.
And it goes all
around you.
You know, we've been instructed to limit our procedures in the hospital and in our ambulances that can cause aerosolization. That's been the instructions that we've received. So it makes sense for folks to be aware of that as well.
Dr. Ernest, good to have you on the program.
Thanks for having me.
Thanks so much, Dr. Ernest Patti, joining us. Straight ahead, the midterms, less than a month.